Now we're going to discuss significance, prevalence, and the severity of spina bifida. So, spina bifida remains a significant health issue in the U.S., with about 3,000 affected pregnancies annually. Myelomeningocele accounts for the majority of these cases and carries the highest level of disability. Severity depends heavily on the lesion level and the presence of hydrocephalus. Although outcomes have improved with earlier diagnoses, fetal surgery, and multidisciplinary care, spina bifida still has major lifelong implications for mobility, cognition, and independence. Prevention efforts, especially folic acid supplementation, have reduced incidence, but disparity remains among underserved communities.
Spina bifida myelomeningocele is a condition that is caused by multiple contributing factors. Genetics play an important role in this, as certain gene variations can interfere with the normal spinal cord formation during pregnancy. No specific causal gene has been identified as of yet. A study has concluded these genetic factors interact with environmental influences. One of the most significant environmental risk factors is insufficient intake during pregnancy of folic acid. It is suggested that pregnant women intake 400 micrograms daily of folic acid supplements. Spina bifida myelomeningocele is a condition that develops through multiple contributing factors. Genetics play a big role in this because they can interfere with normal spinal cord formation, although a specific causal gene has not been identified. According to a study, these genetic factors interact with environmental influences. One of the most significant environmental risk factors is insufficient folic acid intake during early pregnancy. It is suggested that pregnant women intake 400 micrograms per day through folic acid supplements to prevent neural tube defects. Spina bifida myelomeningocele can present in many ways depending on the location of the lesion. The most obvious are the physical defects. Most infants are partially weak or paralyzed in the lower limbs and thus impaired in their movements. Almost 80 to 90% of cases develop hydrocephalus, and this situation may necessitate the use of shunts to drain cerebral spinal fluid. Bladder and bowel dysfunction are also frequent because the nerves that govern the organs are usually destroyed. Incontinence, urinary stagnation, and persistent infections may also be observed in children. In addition to these physical complications, learning and cognitive problems may take place because of brain anomalies or because of shunt complications. Both the pediatric and the community nursing practice must carry out frequent evaluations and keep an eye on failures of the shunt and aid the families to cope with long term malfunction with empathy and education.
Hi everyone, my name is Ebony Douglas and I will be starting with the diagnoses of spina bifida myelomeningocele. The onset of diagnoses usually occur prenatally. The maternal AFP test is a test that detects a rise in the levels of protein, which could be a symptom of a neural tube defect. In case of high results, an ultrasound or fetal MRI may identify a spinal opening and its location. MRI offers a larger amount of data regarding the severity of defects and possible complications such as hydrocephalus. Following birth, physical examinations and spinal imaging, such as an MRI or CT scan, are done to determine the extent of the lesion and nerve involvement. Through accurate and timely diagnoses, timely planning, such as a fetal surgery in case of the former, and postnatal closure within 24 to 48 hours in case of the latter, can be planned. The perinatal nurses and nurse practitioners are essential in the detection of it at the early stages. Parental education and integrated care coordination between diagnoses and intervention. Spina bifida myelomeningocele needs to be managed through a multidisciplinary approach. Surgical closure is the primary form of treatment that occurs either in the prenatal period or immediately after birth. Prenatal surgery or fetal surgery was demonstrated to have better motor outcomes and lesser shunt requirements, but poses maternal and preterm birth risk. Repair of neural tissue after birth avoids infection and safeguards against the bare neural tissue. The long-term management revolves around the physical therapy to build strength, occupational therapy to perform daily tasks, and bladder and bowel programs by catheterizing them or using medication. Nurses organize services and educate the families about hygiene, mobility, and emotional support. Multipolarity of care in early interventions are highly beneficial in terms of development outcomes of quality of life. The prognosis of long-term outcomes is different based on the severity of the lesion and timely interventions. There are a lot of people who survive to adulthood with spina bifida, myelomeningocele, and rely on care. Saham et al. Indicates that early surgery and rehabilitation can considerably improve the level of motor functioning, but a certain level of weakness or paralysis typically remains. Children with hydrocephalus may still have cognitive and learning problems. Assisted technology, mobility aids, and continuous therapy enable the patient to be independent. Patient and families tend to get stressed emotionally, and therefore psychological and social support is essential. Nurses play a leading role in organizing follow-up and linking patients to resources and promoting inclusive education and rehabilitation interventions. The advanced practice nurses can aid in enhancing the quality of life and functional ability by encouraging lifelong care.
Hello everyone, my name is Rachel, and we're going to start this presentation at prevention and cultural competency. Folic acid supplementation remains the single most effective method for preventing spina bifida myelomeningocele. It's highly recommended to take 400 micrograms of folic acid daily before conception and during the first trimester because it can reduce the incidence of neural tube defects by up to 70%. Many countries, including the United States, fortify processed foods such as cereals and grains with folic acid to help ensure adequate folic acid intake. However, not everyone is aware or has access to these preventative measures. This highlights the importance of cultural competence among nurses, who must understand how beliefs, education, and socioeconomic factors influence supplement use. In some communities, women may not seek prenatal care early enough, so they can benefit from the critical preventative window. By providing culturally sensitive health education and promoting access to supplements, nurses can play a measurable role in reducing the risk of neural tube defects. Now, to put things in perspective, we're going to talk about our case study, and we call her Baby A. Baby A is a full-term female born at 38 weeks via scheduled cesarean. At 22 weeks gestation, a prenatal ultrasound showed a possible neural tube defect, later confirmed by fetal MRI as a lumbar L4 through S1 myelomeningocele with mild hydrocephalus present. After receiving counseling, the parents opted for prenatal surgical repair instead of postnatal repair. And at just 24 weeks, baby A underwent fetal in utero surgical repair. Ultimately, this helped reduce nerve damage and lessen the severity of hydrocephalus. The pregnancy was monitored closely for preterm labor and complications, and delivery was planned to protect the surgical site. After birth, baby A was assessed by the neonatal and neurosurgery teams. Monitoring focused on hydrocephalus progression, infection prevention, neurologic function, and surgical site integrity. This case demonstrates the benefits of early diagnosis, prenatal surgery, and multidisciplinary care in improving outcomes for infants with spina bifida. Now, if you can pause for a moment and click the link, I have a surprise for you. It's an animation of a in utero surgical myelomeningocele repair. Now, for case study comparison with research evidence. Baby A's case is highly consistent with what the literature describes for lumbar level myelomeningocele. The mild hydrocephalus and lower extremity weakness match typical clinical patterns. The timing of fetal surgery at 24 weeks also aligns with current evidence supporting early repair to reduce postnatal complications. However, the literature also notes that fetal repair does not eliminate all long-term risks, especially for hydrocephalus, motor delays, and bladder dysfunction. This means baby A's care team must continue close monitoring and early therapy interventions. Now that baby A has discharged, let's address her ongoing care and family education. After discharge, baby A's care continues through a multidisciplinary approach involving neurosurgery, urology, orthopedics, and therapy services. Ongoing monitoring includes head growth for hydrocephalus, bladder and bowel function, and mobility development. The family is taught infection prevention, skin integrity care, and the importance of regular follow-up appointments. Early physical and occupational therapy helps support independence and mobility. With continued care and family involvement, baby A's prognosis is positive, and many children with similar conditions lead active and fulfilling lives. As future APRNs, this disorder highlights the importance of early detection, especially during prenatal care. We will need to educate families using culturally sensitive approaches on folic acid, genetic risks, and available treatment options. APRNs play a central role in coordinating long-term multidisciplinary care and monitoring complications. Counseling families, supporting mobility, independence, and connecting them with community resources are essential. Understanding the evidence allows us to tailor management plans, improve outcomes, and advocate for preventative measures, especially in high-risk populations. In summary, spina bifida myelomeningocele is a complex condition requiring lifelong multidisciplinary care. Prevention begins with folic acid supplementation and public education to reduce neural tube defect incidence. In baby A's case, early detection and fetal repair helped her avoid major complications, such as the need for a VP shunt, leg braces, or wheelchair, and it improved her mobility and quality of life. For advanced practice nurses, this reinforces our duty to promote health, educate patients, and advocate for early intervention. By combining evidence-based care with compassionate communication, we empower families and help children like baby A lead healthier, more fulfilling lives. Thank you.